Hey everyone, welcome back. Today we're going to be taking a deep dive into something you might not expect, the surprising connection between your marital status and cancer treatment.
Yeah, who would have thought, right?
You all know how much we value efficient learning, so this deep dive will bring you the key takeaways from some really interesting research. It turns out that being single, married, or divorced could actually influence your healthcare decisions.
It's kind of a hidden factor that a lot of people just don't realize is even at play.
And we're going to be following the work of Dr. Joan DelFattore.
Oh, she's fantastic.
Yeah, she's a cancer survivor who actually experienced this bias firsthand. Her story and her research are outlined in a 2019 New England Journal of Medicine article, and it's pretty eye-opening.
Yeah, I mean, what's so powerful about her work is that she doesn't just share her personal experience. She really dug into the research. And she kind of exposed this whole pattern that's, I think, really important for people to be aware of.
Exactly. Like, imagine going through cancer treatment and having your doctor hesitate to give you the most effective chemo just because you're not married.
It's wild, isn't it?
That's what happened to Dr. DelFattore. And it sparked her research into this whole issue of marital status and healthcare.
Yeah, it's kind of a wake-up call, for sure.
So let's start with a statistic that really caught my attention. A 2013 study, this was in the Journal of Clinical Oncology, found that unmarried cancer patients are statistically less likely to survive.
Yeah, I remember reading that study. Pretty heavy stuff.
Yeah, I mean, that's a really big deal.
It is, but it's important to keep in mind, right? Correlation doesn't equal causation. Being single doesn't cause cancer death, but it does raise some interesting questions.
Oh, yeah, for sure. And, the same study found that unmarried patients are less likely to receive surgery or radiotherapy, even when it's recommended. So if it's not the patients themselves refusing treatment, what's going on?
Well, that's where things get interesting. And I think also kind of frustrating, there's this assumption that unmarried patients just lack fighting spirit, or they don't have something to live for, like they're not as motivated to get better because they don't have a spouse.
Right, right. And that can really affect how doctors view their cases.
Exactly.
I've definitely heard that type of talk before, and it's honestly kind of offensive.
Oh, totally.
But here's the thing. A large-scale study found that less than 2% of unmarried patients actually declined recommended surgery or radiotherapy.
Yeah, 2%.
It's tiny.
I mean, that small percentage definitely doesn't justify these huge generalizations about unmarried patients and their, willingness to fight for their health.
No, not at all.
You really got to wonder where these assumptions come from.
Yeah, like if it's not the patient saying no, could it be like the doctors are making different recommendations based on their marital status? Could it be physician bias?
That's a great question, and that's actually what Dr. DelFattore tackles head on.
Okay, so what did she find?
So she analyzed 84 studies that used data from the SEER program. Have you heard of that?
Yeah, I think so.
It's a massive database that tracks millions of cancer patients. What she found is kind of alarming.
Okay, I'm listening. I'm ready.
She calls it expertise creep, and it's basically where researchers or doctors make social judgments about patients that really go beyond the actual data.
Okay, so help me understand. What would that look like in a real-world scenario?
Okay, so imagine a doctor saying something like, well, since you're single, you probably don't cook healthy meals, so chemo's going to be harder on you. That's expertise creep.
Wow, that's a really clear way to understand it.
It's basically like judging your life without even knowing you.
So she found that this expertise creep was happening a lot in cancer research.
Exactly. It's like these studies were making all these assumptions about unmarried patients without any real evidence.
And that's a problem because
It's not just some abstract academic debate. These assumptions can actually influence treatment decisions.
and that has a very real impact on people's lives.
Exactly. It's serious stuff.
Yeah, it's not theoretical. There are real consequences.
For sure.
So there was one study that Dr. DelFattore analyzed that tried to say that unmarried people are more likely to be depressed and therefore might not follow their treatment plans as carefully. But the only evidence they had was this one study about depression rates across different countries. And it didn't even include data on all unmarried people.
Seriously.
It was just divorced and separated people.
Wow.
So it's like flimsy evidence that's trying to prop up this harmful stereotype.
It's a classic case of trying to fit the data to the narrative you already have.
Right, exactly. And even if there were solid data on depression rates, it's a huge leap to assume that just because you're unmarried, you're automatically going to be less likely to stick to your treatment plan.
It's just not a logical connection.
No, I think it's important to define a term here that we're going to be talking a lot about, implicit bias.
Yes,
Can you
absolutely.
hear to that?
Oh, for sure. Yeah.
Okay, so for our listeners, can you just explain what that is?
So implicit bias, it's basically the stereotypes we have, but we don't even realize we have them.
Oh, so they're subconscious.
Exactly.
Yeah.
And that's why it's so dangerous, right? Because it can affect our decisions without us even meaning to. And, there's a lot of research showing that this affects treatment decisions based on race, gender, you name it. So it's not a stretch to think marital status could also be a factor.
Yeah, that makes a lot of sense. So you're saying that this expertise creep, as Dr. DelFattore calls it, that she uncovered could actually be fueled by implicit bias.
Exactly, because the stereotyping of single adults, it's a really well-documented phenomenon. It's, sad to say, but it's pretty pervasive in our society, and healthcare is no exception.
So we've got this, deeply ingrained bias against unmarried people, and it could be affecting how doctors treat their cancer patients. What are some specific arguments that people are using to justify this bias?
Well, one of the big ones is that unmarried people just don't have the same level of social support.
Right, yeah.
And somehow this leads to worse outcomes. It's like this equation. Unmarried equals lack of social support equals worse survival.
Right. Like if you're not married, you must be all alone, struggling. You can't handle cancer treatment.
It's such an oversimplification,
Yeah.
And it's pretty insulting.
To anyone who has chosen to be single
Mm,
or built a support system outside of marriage.
exactly.
But, social support is crucial
Oh, absolutely.
for handling cancer treatment. I mean, it's a tough journey. Having people to lean on makes a world of difference.
Mm.
But social support isn't the same as being married.
Right. And that's where some of the research gets, shaky, to be honest. So Dr. DelFattore found this study that claimed married people have better social support and therefore better survival rates.
Okay.
And they cited this Psychology Review article as evidence. Sounds pretty convincing,
Right.
right? Except the article they cited, it didn't even mention marriage.
Wow.
What it actually talked about was how complex social support really is. You've got family, friends, community ties, emotional support, practical help, all these different aspects.
So they were basically cherry-picking data to support a bias.
Yeah, and this is a perfect example of how research can be twisted to fit a narrative.
It's wild. And the funny thing is that some research suggests that unmarried adults actually have stronger social networks than married people.
It's true. It really makes you think.
It really does. This is all so fascinating. But I have to admit, it's also kind of disheartening. It's a little scary to think that people might be denied the proper treatment just because of their marital status.
Mm.
What does all this mean for us? As patients, what can we do to protect ourselves from this bias?
Well, that's a great question, and it's something we're going to be digging into after the break, because knowledge is power.
Okay, great. We're going to take a quick break, but be sure to stick with us. We'll be right back.
All right, so let's get practical. How can you, as a patient, make sure you're getting the best possible care no matter what your relationship status is?
That's what we really want to focus on here. It can feel really intimidating to question a doctor, especially about something as serious as cancer.
Oh, for sure. But, it's your health, your life. You really have the right to be an active participant in your own care.
So what's step one?
Well, I think knowledge is power. Do your research, understand the recommended treatments for your specific type of cancer.
Okay, so where should people go to get good information?
Reputable sources like, the National Cancer Institute, the American Cancer Society, those are great places to start.
Yeah, those are great.
They have tons of information on different treatment options, potential side effects, clinical trials, all sorts of stuff.
And don't be afraid to get a second opinion
Oh, absolutely.
if you're not completely comfortable with the first doctor's recommendations.
A second opinion can give you so much peace of mind or just help you see things from a different perspective.
Totally. Here's a tip that I think is really important. When you're meeting with a doctor, be upfront about your support system.
Yes.
Explain who you have in your corner, whether it's family, friends, neighbors, even online support groups.
Be specific. Don't just say, I have friends.
Right.
Really paint a picture for them. Explain how these people are going to be involved in your care. Are they going to be driving you to appointments, helping you with meals or medication? Just being there for emotional support. Give the doctor a clear sense of all the resources you have available.
Like you're showing them, hey, I've got this.
Exactly. You're demonstrating that, even if you don't have a spouse by your side, you're not alone. You're ready for this.
You got a team.
Yeah, you've got a team.
And remember, you're not obligated to share, any personal details about your relationship status if you don't feel comfortable.
Oh, totally. That's completely your choice.
Your focus should really just be on the practical aspects of your support system. How those individuals will help you manage treatment.
Right. It's about being practical.
So I know this might sound a little confrontational, but if you sense any hesitation or bias from your doctor, like based on your marital status, don't be afraid to address it directly.
Yeah, it's okay to call it out.
So how would you suggest going about that?
You could say something like, I understand my situation might seem, different, but I want to assure you that I have a really strong support system in place, and I am fully committed to following through with the recommended treatment.
Oh, that's perfect. It's direct, but it's also respectful, right? You're stating your commitment to your health, but you're also addressing those potential concerns head on.
And if you feel like your concerns aren't being heard or respected, don't forget, you can always switch doctors. Finding a healthcare provider who really listens to you and understands your needs, that's so important.
It's like finding someone who sees you as an individual, not just a statistic or a marital status.
Exactly. And remember, there are resources out there to help you navigate all these challenges.
Oh, that's great.
So organizations like the National Coalition for Cancer Survivorship can connect you with, support groups, advocacy services, even legal aid if needed.
That's fantastic. So it's all about being proactive, informed, assertive.
You are in the driver's seat when it comes to your health.
So we've talked a lot about patient advocacy, but what about physician advocacy? Shouldn't doctors also be part of the solution here?
That's such a great point. If physicians are aware of this potential bias, they can be really powerful advocates for their unmarried patients.
Yeah, within the system.
Yeah, exactly. They can challenge those outdated assumptions, make sure that their patients are being treated fairly. It's like they have this responsibility to stand up for their patients.
Right, and make sure everyone's getting the best possible care.
Regardless of, background or anything else, it's about creating a culture of awareness.
And sensitivity.
Yes.
Yes.
Within the medical community.
And this goes beyond just marital status, right?
Oh, for sure.
We need to be mindful of all kinds of biases that can, creep into healthcare decisions. Race, gender, socioeconomic status, sexual orientation, you name it.
Yeah, it's about recognizing that every patient is an individual, right? With their own unique needs and circumstances. And those individual needs, they should always be at the forefront of medical care.
I love that. So what are some practical steps that physicians can take to combat this bias?
Well, for starters, they can educate themselves. There are workshops, online courses, even books dedicated to implicit bias in healthcare.
Like continuing education.
Exactly. And just as important, they can make a conscious effort to examine their own biases and assumptions.
Which I'm sure can be hard.
It can be. But recognizing those biases, that's the first step towards mitigating their impact.
So it all comes back to awareness.
Awareness is key.
Okay, what else?
Well, they can create more inclusive and supportive environments for their unmarried patients, like, simple things like asking about their support systems, providing resources for caregivers, acknowledging the challenges they might be facing. These can make a huge difference.
It's about making them feel seen.
Seen and heard, not judged or, marginalized.
Yeah, exactly. And when it comes to making treatment recommendations, physicians really need to focus on the objective factors.
Absolutely.
The patient's medical history, stage of their cancer, their overall health.
Instead of making assumptions based on their relationship status.
Right, exactly. And, advocating for unmarried patients, it doesn't mean treating them differently than married patients. It's about ensuring they're receiving the same level of care and attention.
It's about equity, fairness in healthcare.
We've talked about what patients can do, what physicians can do. What about the system itself?
Yeah.
What can be done on a larger scale to address this?
Well, I think that's where policy and institutional change comes in, right? We need to advocate for policies that actually protect unmarried patients from discrimination in healthcare settings.
So it's like changing the rules of the game.
Exactly. For example, we could push for legislation that requires hospitals and clinics to provide resources and support services specifically for unmarried patients.
Yeah. That makes sense.
Or advocate for changes in medical education so that future doctors are trained to recognize and address their own biases from day one.
Oh, from the beginning. I love that.
Yeah, and let's not forget about research. We need more studies that actually investigate the impact of marital status on cancer treatment and outcomes.
Right.
The more data we have, the better equipped we'll be to address this issue effectively.
It's about using evidence to drive change,
Yeah, and create a system that truly values and supports all patients.
regardless of relationship status. This deep dive has really highlighted the importance of critical thinking when it comes to medical research.
It's so important.
It's so easy to accept statistics and generalizations at face value. But we need to dig deeper, question those assumptions, look at the individual stories behind the data.
And we need to be aware of our own biases, as patients and as healthcare providers.
Because those biases can have a huge impact on people's lives.
Even the unconscious ones.
Yeah. Ultimately, it's about advocating for a healthcare system that prioritizes the well-being of all patients.
Regardless of marital status or any other factor that might lead to biased treatment.
So where do we go from here? We've uncovered this bias. We've talked about some solutions. What's next?
That's a great question. And it leads us to a really interesting thought. So Dr. DelFattore's research really focused on the risks that unmarried patients face. The risk of being denied the best treatment because of these harmful stereotypes. But what if we flip the script for a second?
Okay, I'm interested. How do we flip the script?
What if we consider the potential benefits of being unmarried?
Ooh, I like that.
When it comes to cancer treatment, that is.
That's a perspective I hadn't thought of before.
It's thought-provoking, right?
We've talked about how unmarried individuals often have these strong social networks.
Yeah.
And diverse support systems.
Mm-hmm.
They might have, close-knit groups of friends,
Mm-hmm.
supportive siblings, even online communities where they find, understanding and encouragement.
And these connections can be so valuable during such a challenging time.
Right, like cancer
Sure.
treatment. So could it be that those support systems, free from the traditional, expectations and structures of marriage, actually provide a unique advantage?
It's possible. It really challenges us to rethink our assumptions about, what constitutes optimal support. Maybe it's not always about having a spouse.
Maybe it's about having this network of people who truly understand your needs and can provide the specific kind of support you need in the moment.
Yeah, it's about recognizing the strength and resilience.
Of those who choose to live outside these conventional norms.
And celebrating the diversity of human connection, right?
Uh,
Support can come in so many forms.
Exactly. So while there's clearly a risk of bias against unmarried patients, there's also this potential upside.
Yeah, this possibility that their unique support systems could be a real source of strength and resilience.
It's like a hidden superpower,
I love that.
right, that we're just starting to understand. So it's about shifting our perspective and recognizing that there's more to the story than just, the negative aspects.
Mm.
There's also a potential for strength and resilience in these unexpected places.
And it reminds us that every patient's journey is so unique. There's no one-size-fits-all approach to support or care.
This has been such a great conversation. I think it's a perfect example of what the deep dive is all about. Uncovering these hidden truths
Challenging assumptions.
and exploring complex issues with an open mind.
It's about sparking curiosity and encouraging our listeners to think critically about, the world around them.
So as we wrap up this deep dive, I want to leave you with a final thought-provoking question. We've talked about the risks and the potential benefits, but ultimately, what does it all mean? How do we move forward in a way that ensures, equitable and compassionate care for all cancer patients?
That's the million-dollar question, isn't it? And I think the answer lies in an ongoing dialogue, continued research, and a commitment to challenging our own biases.
It's about recognizing the inherent value and dignity of every individual, regardless of their marital status.
Or any other characteristic that might make them, different.
And it's about creating a healthcare system that truly reflects those values.
A system that's built on empathy, understanding, and a deep respect for the unique needs and experiences of each patient.
Well said. Thanks for joining us on this deep dive. We'll catch you next time for another fascinating exploration. It's like we almost need to broaden our definition of what support really means when we're talking about cancer care.
Totally. We tend to have, such a narrow view, often equating it just with spousal support.
Right.
But there are so many other forms of support that can be incredibly powerful.
Think about it, like close friends who really rally around you, siblings, even online communities where people can connect and share their experiences. offer words of encouragement.
Those connections, they can be lifelines, especially for people who, um, you know, don't fit that traditional mold.
And then there's professional support too, right?
Oh, absolutely.
Therapists,
Social workers,
support groups for cancer patients.
all those resources can provide so much guidance and emotional support.
It's about recognizing the strength and resilience that can come from these like really diverse support systems.
Exactly.
Maybe, not being married actually allows for a more personalized and adaptable approach to care,
That's a good point.
where individuals can kind of like draw on the strengths of their chosen network.
It challenges us to really move beyond that one-size-fits-all model of support and recognize that every patient's needs and strengths are unique.
And maybe that shift in perspective could lead to, more personalized and effective cancer care for everyone,
For sure.
regardless of their relationship status.
It's about empowering patients
Yeah.
to take ownership of their treatment journey and build the support system that works best for them.
So as we're wrapping up this deep dive, I really just want to, encourage you to think about the power of connection and community.
In whatever form it takes, right?
Yeah, absolutely. Whether you're facing a personal challenge like cancer or just, navigating the ups and downs of life, remember you don't have to go it alone.
And if this conversation has sparked your curiosity,
Yeah.
I would encourage you to check out some additional resources on implicit bias in healthcare.
Yeah, there's so much good information out there.
It's a complex issue, but it's so important.
It really is.
There are some fantastic organizations doing amazing work in this area, like
Like who?
the Institute for Healthcare Improvement, the Association of American Medical Colleges.
Okay. Yeah, those are great.
They have tons of information and resources available online.
That's awesome.
And, don't underestimate the power of just having a conversation.
Yeah, talking about it.
Exactly. Talk to your friends, your family, even your doctor about these issues.
Normalize the conversation.
Exactly. Because the more we bring these biases to light, the better equipped we'll all be to create a healthcare system that truly serves everyone.
Well said. Thanks for joining us on this deep dive. We'll catch you next time for another fascinating exploration.